Hello and welcome to Introducing the BSLM Learning Academy. My name's Dr. Ellen Fallows. I am the BSLM Learning Academy Director. I just want to start by wishing the best of luck to all our hundreds of candidates sitting the IBLM diploma exam over the next few days as we go live with this virtual conference, and particularly those who've been juggling very difficult clinical workloads during the coronavirus pandemic, and for those parents out there for whom childcare options really have evaporated during coronavirus restrictions. So good luck to you all, and I hope this virtual conference has really helped you prepare for the exam. So why do I get the pleasure of launching the BSLM Learning Academy and being the interim Learning Academy Director? So a bit about my background. I've been a GP partner for the past 10 years and diabetes lead in my practice. And I've been very fortunate to be involved in a number of research programs delivered by the University of Oxford called Droplet and Diamond, where we saw real life support for lifestyle change being delivered in primary care with some very exciting results. And this has convinced me that I want to deliver support for frontline clinicians to practice lifestyle medicine in a way that not only helps their patients, but brings back the joy to medicine. I think we can be much more ambitious in the NHS and support all of our patients to reach for remission of conditions such as type 2 diabetes, depression, osteoarthritis, obesity and hypertension, and not just use lifestyle medicine approaches for prevention and treatment. So I have some experience at the moment. I'm working with the RCGP team in their person-centred care programme. I've been very fortunate to be part of the NHS England's virtual group consultation pilot to support practices in this delivery, and with the Complete Health Improvement Programme team with whom I'm going to be delivering a pilot intensive lifestyle change programme, and with Momenta Health, who are delivering one of the NHS's type 2 diabetes remission programmes. And I really appreciate being part of the coalface supporting the social prescribing link workers locally as their clinical mentor. So it's a really exciting time to be part of the British Society of Lifestyle Medicine. I believe that patients and coalface clinicians really get why we need this sort of approach. And I think the coronavirus pandemic has really thrown metabolic conditions in particular into the limelight, as we found out that a lot of these conditions, so obesity and type 2 diabetes, really increase the risks for poor outcomes for patients with coronavirus. And it's fantastic to see that the government really putting, for example, physical activity and weight management as a priority. And I believe that the BSLM can really support with those aims. So now is the time. I think we are riding a huge wave of support and seeing huge growth since our foundation in 2016. So we now have well over 1,000 members, and they come from a wide range of backgrounds, including patients, nurses, physios, health coaches, these newer roles in the primary care networks in general practice, social prescribers, GPs, hospital doctors, policymakers, and both from NHS and the private sector. And we're part of a growing international community. So, for example, we're part of the Lifestyle Medicine Global Alliance, which includes the American College of Lifestyle Medicine and the Australasian Society of Lifestyle Medicine. And we're also part of the American Board of Lifestyle Medicine. So our vision is to support a world where people can achieve optimal health by using lifestyle medicine to address the root causes of illness. And we have a number of tools to deliver this that include things like health coaching, group consultations, social prescribing, shared decision making, and something that I feel very passionate about and is close to my heart, person-centered care. And hopefully you'll be hearing a lot about this throughout these next 3 days in this virtual conference. So these tools are something that can be used to help implement the science and evidence base behind things like sleep for health, healthy eating, physical activity, stress management, social connection and connection with nature, avoidance of tobacco, smoking and alcohol and drugs, for example. We have a number of aims including raising awareness of the principles and practices of lifestyle medicine. Importantly, what it is and what it isn't. There's sometimes some confusion over this. We'd like to promote greater adoption of lifestyle medicine in healthcare and society, provide opportunities for learning, knowledge sharing amongst healthcare professionals around lifestyle medicine, and develop a solid evidence base to support the use of lifestyle medicine in the treatment, management, and reversal of chronic disease. And on that last point, that's where we come in to deliver those aims as the Learning Academy. So the aim of the Learning Academy is to deliver a trusted resource of education and standards for the practice of lifestyle medicine that is most importantly, and this is close to my heart, practical. We need to be able to do this in busy clinics where we're managing real life people with multiple different long-term conditions and needs. We need to be up to date. Finally, the evidence base and research in, for example, nutrition, physical activity and sleep is just racing ahead and rapidly developing. And we want our education to be founded in very good quality evidence base. So we have a number of goals, short, medium and long term. In the short term, we'd like to create a steering committee, and we've made really good inroads into this, and I'll introduce them to you today. We would like to have a maintenance of certification for those who've already undertaken and passed the IBLM diploma. We'd like to provide the International Board of Lifestyle Medicine diploma more questions that are perhaps focused on or relevant to UK practice. We'd also like to support those studying for the IBLM diploma with an MCQ book for practice. And we'd like to continue to accredit educational courses and patient resources involved in lifestyle medicine and build relationships with academic institutions and other lifestyle medicine organisations. We also are starting to develop a national virtual student lifestyle medicine meeting programme. In the medium term, we'd like to have a certificate in lifestyle medicine for non-medical professionals, so those health and wellbeing coaches, social prescribers, nurses, the people who really do deliver perhaps the long-term condition care, particularly in primary care. We'd like to support undergraduate education in medical nursing and allied health practitioner schools. We'd like to deliver innovative educational experiences, perhaps that really implement some of the principles of lifestyle medicine, so that when you are learning, you also get to have practical experience of some physical activity amongst the learning, or perhaps some mindfulness or stress management. And one of the ways we thought we could deliver this would be to have an adventure ed programme for both members and patients. We'd like to develop a rigorous MSc in lifestyle medicine and produce a BSLM lifestyle medicine textbook to support the BSLM exam preparation with more NHS and UK-based examples. There is a lot of good work going on at the moment in the NHS that is very much delivering a lot of the lifestyle medicine principles. We'd like to develop high quality publishable educational research which can be submitted to the Lifestyle Medicine Journal and other relevant journals. And excitingly, Fraser Burrell, who I'll introduce you to in a minute, is the editor of the new Lifestyle Medicine Journal, and the first edition will be shortly published. In the long term, we'd like to deliver a BSLM diploma course and exam, again, that's more UK based and relevant to NHS practice, and deliver an accreditation process for lifestyle medicine practice in the UK. So lots of work ahead of us. So now to our steering group that we've been working to pull together. So we're very lucky to have Dr. Karen Adamson as our BSLM Learning Academy expert advisor. So Karen is currently a diabetes and endocrinology consultant working as clinical director of NHS Lothian. She holds a master's in clinical education and has 10 years of experience writing and setting the membership of the Royal College of Physicians Part 1 exam questions. She has also been an associate director of medical education with experience ensuring quality of training and education. Dr. Fraser Burrell is Director of the BSLM Science and Research, and Fraser is a consultant rheumatologist and senior lecturer at Newcastle University. He's been a pioneer of group consultations, and I'm sure you're going to hear more from him about this later on in the conference, and he works in secondary care. He's also a Principal Fellow of the Higher Education Academy, Engagement Lead for the MRC Arthritis Research UK, and holds a Master in Clinical Research. As mentioned previously, he's the editor of our Lifestyle Medicine Journal. Dr. Frances Elliott is currently our BSLM Executive Director and is really helping to launch the Learning Academy with her extensive experience in numerous senior level posts, including Medical Director, Chief Executive, Deputy Chief Medical Officer and Interim Director of Research and Development for various bodies, including Fife Primary Care NHS Trust, NHS Quality Improvement Scotland, Healthcare Improvement Scotland, the Scottish Government Health and Social Care Directives and NHS Fife. So she brings her huge wealth of experience of having worked closely with the Director of Medical Education on the NHS Fife to contribute to the development of the first Scottish graduate entry medical degree, jointly with the Universities of Dundee and the Universities of St Andrews. Maeve Regan is the latest to join our team. She is going to be the BSLM Learning Academy product developer, really helping us to find the right learning platform. So Maeve currently manages the British Medical Association's Learning and Development team, and she's worked on a leadership training program recently for PCN clinical directors using webinars, masterclasses and e-learning, which will be very useful for the sort of a blended learning approach that we would like to deliver in the Learning Academy. She's also had experience working on the Nursing Midwifery Council, supporting its international professional qualification recognition systems. So a really fantastic team to start this huge body of work that we're about to embark upon. So just briefly about how we see the Learning Academy structure being set out. Most importantly are going to be various different groups, including of course our members who we want to hear from in terms of what you feel you need to help you deliver lifestyle medicine in real life medical practice. We will also have a number of Learning Academy associates, so individuals who would like to contribute from their particular area of expertise. You might be able to help us with making sure that the e-learning and the various outputs that we produce are really user-friendly. We already have a number of special interest groups who will again contribute from their point of view and their expertise. And we are looking for Learning Academy collaborators, for example, from universities and other educational establishments. And all of this, these groups will feed into our BSLM executive group who really run the BSLM charity, and of course the BSLM trustees who make sure that the charity is sticking to its original aims and delivering to its various members. And all of this team will feed into the steering group who've got to start delivering on the aims that we've discussed. So far, what have we achieved? Well, as we've talked about, we've recruited key members of our steering group, and I'm very excited to have such a fantastic team. We've already accredited dozens and dozens of courses and webinars, and also patient education resources that can deliver lifestyle medicine. We've provided MCQs in the IBLM diploma exam to reflect UK practice, and we're starting to reach out to other academic institutions working in similar fields to us. We've already embarked on this new MCQ textbook to support the IBLM diploma exam preparation, and we're really looking forward to the next steps. So we really need to hear from everybody, so get in touch, particularly if you'd like to be a collaborator or an associate, if you would like to join some of our special interest groups in nutrition, physical activity, nature, and members. Particularly, I'd like to hear more from our nursing colleagues, social prescribers, health and wellbeing coaches. And patients, it's very important to us that we can deliver really good resources to you in ways that you can use evidence-based lifestyle medicine approaches to improve your health. So here's my email address. Do send an email, or you can use the question and answer link at the side of this presentation to ask some questions following this presentation. Thank you very much.